Greetings. So my name is John Hall. I'm a nurse practitioner and a primary care provider working here somewhere up in the northeast of the United States. So this video I'm going to talk about today is actually to go through a very simple basic case study on COVID vaccination, how it works, why I think, and how this can be effective in helping you to mitigate this disease. Reason why I'm talking about this is I am trying to do my best to try and make sure that the right information is out there. We're getting this information to the hands of patients so that they can make the best possible decisions about their decision to get vaccinated. Well, I can fully respect and understand people's intentions to be able to make their own decisions about their health care and what happens with them and their health and well-being. I also think it's absolutely imperative that we get the right information to you at the right time, and that's what this video is going to be all about. So what I'm going to do is going to point out a quick case study on some patients that I've taken care of and how I have seen their healthcare managed with the COVID vaccination. So I have a family of four, 2 adults in their 30s, 1 in their 70s, and another 24-month-old, all living under the same roof. The 3 adults all carry some risk factors for COVID-19. In working with the family and having very direct discussions with them about vaccination and its purpose and role in all of this, they all 3 adults were vaccinated in the early stages of the pandemic. One of those adults, who was 30 years of age, became infected with COVID-19. We do know that in this particular case, it was the Delta variant. The trajectory for that patient's illness was approximately about 7 to 10 days worth of not feeling very well, mild course of symptoms, was able to remain home throughout the course of illness, and did not need to be hospitalized. The other 2 adults living under the roof also did very well. They did not get infected and remained healthy throughout this patient's course of illness. In addition, the 24-month-old that was living in the same house also remained healthy and did not get sick. So what are some of the takeaway messages or takeaways that we can have in this particular case? Number 1, if you are vaccinated and you do get sick, it is most likely that you're going to have a mild course of illness and that you will generally do well. Yes, we are seeing some breakthrough infection, but this was potentially anticipated and understood as a potential course of this illness. So that's number 1. Number 2, if you're vaccinated, you are less likely to spread the virus to somebody else. Number 3, if you are vaccinated, you are less likely to get sick. And 4, if you're not able to be vaccinated, if you're surrounded by those people who are vaccinated, you're less likely to get sick as well. So, that's really a very simple, well, it's not extraordinarily scientific, and it's a pretty simple case study, but I think it's one that actually I think paints a good clinical picture as to why you should seriously consider getting vaccinated. You can contrast that with another case that I had, which was a 30-year-old patient who was generally healthy. I would consider relatively low risk factors for COVID-19, not vaccinated. This patient was hospitalized for about 10 days in ICU on a ventilator, 1 to maybe 2 near-death events. Additional 2 weeks of hospitalization to convalesce and recover, an additional probably 6 to 8 weeks out of work, and is now just getting to the point where they're returning back to work. That patient is now facing a pretty extensive hospital bill potentially for their stay. And generally also I don't know what the long-term trajectory for this patient is going to be. While I fully expect that they'll recover and be healthy, I may not know whether or not they're actually going to go on to develop anything like asthma, breathing problems, or other issues. So, and it's hard for me to actually have a solid predictor as to what the outlook for that particular patient is. So I think that contrasted with the other case that I outlined for you, I think paints a very unique picture where you can look at one case where one individual gets sick, and not only because this person was vaccinated, but the rest of the people in their household, they remained healthy and had a good outcome. Contrast that with somebody else who made the decision to not get vaccinated, and they had a much more rocky outcome. So I hope maybe you took a little bit something away from that, and um, that's where we're going to sort of end this video off. Okay, so thanks for listening, and I appreciate your time. Take care.